Dr. Ashish Jha, the Dean of the Brown University School of Public Health. Dr. Jha, thank you for joining us. And let's start, of course, with that major news from the CDC, cutting in half the isolation time for people with asymptomatic COVID infections from 10 days down to 5 days. Given, though, how rapidly Omicron is sweeping across the country, is 5 days of quarantine enough to stop the spread of this variant?
Yeah, good morning, and thanks for having me back. Yes, I think it is for people who are asymptomatic. What we know is that people do most of the spreading, they're most contagious in the couple of days before they have symptoms, and usually in the 2 to 3 days after symptoms begin. So if 5 days later you feel well, the CDC recommends, and I agree with this, that people can break out of isolation, but they just continue to need to wear a mask when they're around others for at least 5 more days. I think if people followed that, that would be a pretty reasonable alternative to what we have right now.
But the CDC is not requiring people get a negative test result to end isolation. This is something that you had been calling for. Is it a mistake not to require at least one negative test?
Yeah, I actually think it would help a lot if we did ask people to get a negative test as well. It would actually make a big difference. So I don't know why the CDC did not put that in. I suspect it might be because tests are still hard to come by, and that may make it even harder. But that said, certainly adding a negative test would make a big difference.
We do know those tests have been hard to find. And of course, we just reported on the rise of COVID cases among children. Dr. Jha, why are more children going to the hospital now? Is there something different about Omicron and the way it affects children?
Yeah, this is obviously a concerning trend, and we need to sort this out. We don't know if Omicron is any more dangerous for kids than prior variants were. I suspect some part of the story, of course, is that a lot of kids remain unvaccinated. Under 5 kids are not even eligible. Of 5 to 17, a lot of parents have not yet gotten their kids vaccinated. I think that just makes them more vulnerable to having a bad outcome. So I suspect that's the major reason, but we need to really understand this more closely.
And as parents try to navigate this all, given the spike in pediatric cases, we are seeing some school districts weighing whether to delay returning to school after the holidays. What's your take on all of this?
I think schools can come back after the holidays. And we've seen over and over again in this pandemic that if we apply the right set of mitigation measures, getting people to mask up, having improved ventilation, a lot of investments have gone into ventilation, using testing. If we do all of those things, and of course, really requiring vaccines for adults and encouraging it for kids, that combination can keep kids and teachers safe in school. And that's what I think we should be using.
We certainly hope so. Dr. Jha, thank you as always for joining us. Thank you for your information and your insight.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.